Okay, as Lorenzo already mentioned, I'm a project manager actually at the Innovation Technology Unit at Exprivia. Who is Exprivia essentially? Okay, Exprivia is an ICT company, is one of the biggest company in the south of Italy. And it's a group that leverages on digital technologies to steer the business drivers of change for our customer. So basically, we explore we have different solutions in different areas, starting from the health and smart cities and going to aerospace and also to industry. And we make use of different digital enablers in order to provide solutions for our customer, which are not only healthcare authorities or public administrators, but also university and research centers with which we collaborate. One of the assets of our company is the Innovation and Technology Unit, which is the backbone of the Exprivia Research, Development and Technology. And so we try to integrate our different expertise, because we are physicians, bioengineers, and also biologists that work all together, and that we try to provide a solution to help our digital factories that works on the production of the solution to innovate their solution and also to take part to bigger proposals, and so to combine our solution with also other person. So this is just an overview of the group and also the success that we were able to reach during these years in terms of research projects and funding that we are involved. So today, I'm not talking a lot about our success in terms of solutions, but I would just to arise some issues that we are experiencing that I think that could be useful to talk about, because I mentioned my presentation was on the impact of the medical device regulation on data quality, because why data quality and how we can provide something that is useful. So the new regulation essentially does not impact the functionality or the risk profile of the products, as I'm sure my precedent speakers have mentioned, but it's also important. There are some compliance requirements that are essential, that are significant. And as such, the entire industry is focusing on prepared to this compliance. Of course, the new regulation transition period has been extended in order to give time to the companies and also to the university to adapt to this change and to take these regulations. And essentially, what is new? So the new regulation has adopted a life cycle approach to the medical device regulation. And the things that I want to stress a little bit were about the quality management system, the post-market surveillance system, and the clinical evaluation requirements, which are essentially steps that have been stressed in the new regulation and that are in some way related to the fact that to the data quality. So considering the fact that we have this new regulation, we as a company have provided several solutions. One of the most famous in the healthcare sector is the fact that we provide the national healthcare system to manage data from the local healthcare authorities in the Apulia region. So more than 10 years ago, we started this process to evolve to electronic health records for the region, and then to expand to the national level. But of course, lesson learned, as also the others said, right now we have a multiverse of data in healthcare that are coming from different sources. And of course, also the concept of health has been changing, because we are evolving from an approach where we get in touch with, as the pandemic has demonstrated, we are not only just us with the process of failure of our own mechanism, but there is also the environment and the animal health that are part of what what changes that can occur in our process of aging. And so essentially we are moving to a concept from just health of people to a planetary health, where we have to deal different also sources of information, but also meaning of information and how this information could be related to our personal health. So how we can trust all this information, and also how we can trust also the information that are coming from different devices. So real world data, the medical device industries both on board the impressive increase in the use of personal data, and also in terms of real world data that are strictly connected to the concept of real world evidence. So we have to provide more and more data that needs to be trusted by the system that are going to combine all this information, and we have to provide evidence, which is something that also the regulation requires, that are strict and that are essential and accurate. So how we can give reliability to all these real world data? And essentially the primary factors can be the data accrual, so how the data were collected, and also in terms of data assurance, so whether the people and the process during the data collection and analysis can provide adequate quality and integrity to the data. Because it's essential that if we have to combine all this information both for primary or secondary use that are the results of mixed system, and also that are all from different also point of view, we must therefore pay attention to the whole chain of transformation and treatment of the data. And this is where the concept of data quality is essential. So poor data quality could lead to patient mistreatment, increased bottlenecks, and poor decision, of course. So once the data could be entered in a system, in an electronic health record, it would be complicated to modify that information if at the end of the process. So also in terms of pure decision, there could be inaccuracy in a data lead that, of course, could lead them to mistreatment and also to employee frustration. So the data quality dimension needs to be considered when dealing with this changing environment. And so a good management of data quality builds a foundation for all the initiative of a business. In order to achieve high quality data, it's necessary to make this a kind of holistic continuous process. And there are some dimensions of and strategies that we could use to improve data quality. This is just a summary of some of them. So governance, standardization, cleaning, validation, staff training, and technology, and also audits that could improve you to reach the benefit of data quality in healthcare. In terms of data governance, so it's essential to establish policies and procedures that ensure the data is managed in a consistent and standardized way across the organization. And this is important as a first step in order to deal with this. But of course, also data standardization, which is something that we are really involved right now, because standardizing data elements such as terminology, coding, and formatting can help ensure data is consistent and accurate across the different systems that are put all together, that we have to combine together. And the concept of standards is necessarily related to the concept of interoperability, which is one of our goal in the project there where we are involved in. So we are trying to work together to improve also interoperability, which has several dimension and level, and one of that is the fact that we have to achieve not only a foundational and a structural and organizational interoperability that could be in this some sense ensured also by the standards, but also we have to think to the semantic interoperability, because as I mentioned, we have also information that are coming from different devices, but also from different sources. And so how we combine this information and how we trust this information that are passed in order to be used to make decision better, it's essential in the process to improve it. And another important thing that I would stress is the concept of data cleaning, which is something that is done to clean data by removing duplicates and correcting errors, but it's also connected to the concept that if we receive data from different sources that are semantically homogeneous and physically comparable, how we cannot confuse, for example, our heart rate under stress with one at rest, even if the unit is the same. So we have to introduce more information in order to provide the right concept at the end and to the medical doctor. So why data quality then is important, is a key to success driven by technology, because without high quality data we are at loss. So we need, and this is the starting point to ensure high quality data is the process of certification of all the device and information that we can provide and that we can include in the system. And so how we help in this process as a tech enterprises along with the other bigger actors that are involved in this ecosystem, we hope to promote and support the innovation, of course, in medical devices, provide the reliability to the real-world data in sense of an open health data space, and so ensure interoperability between different sources of information, but also coming from different field of expertise. And of course, mapping quality data to be compliant with the EU medical device certification, and of course, supporting the technical documentation, which is, as we all know, one of the most complicated facts. So essentially, we would try to strive innovation by being compliant to the new regulation and also enable all the people to be aware of the potentiality of the data that they share and the system that they combine to improve their health. Thank you.